All right, so this is chapter 22, Psychiatric Emergencies. So it's oftentimes that we get called to somebody that's experiencing a behavioral crisis or psychiatric emergency, and it actually has nothing to do with a mental health issue. Oftentimes, the crisis can be because of something medical that's going on that's making them not act correctly. It can be mind-altering substances, stress. It can truly be a mental illness, but a lot of times it's not actually. There's many other causes that can cause you to act not like yourself. Um, Myth versus reality. So, at some point, most people in their life will experience an emotional crisis. This doesn't mean that everybody develops a mental illness. It's more an acute or temporary mental health disorder that doesn't last for a long time. So try not to just jump to the conclusion that somebody or yourself has a mental illness just because you describe or you experience a short emotional behavioral response. So, a myth is that if you're feeling bad or depressed, you must be sick. You must have true depression. There are several different reasons that you could be in a depressed state. And generally, that's going to be something that has happened in your life that has caused additional stress. So, divorce, loss of a job, death of a relative or friend. Depression is a long-term mental illness that is because of something more than just a big event in your life. Many people think that those with mental illness or mental health disorders are dangerous, violent, or otherwise unmanageable. And it's true that, yeah, there are people like that, but it's a very small percentage of people. We are normally exposed to violent patients because we are called to people that are violent. But for the most part, you have people walking around all day, every day out in society that may be struggling with their mental illness, but are far from being dangerous or violent. Um, Although you can't just determine what has caused a patient's crisis, you may be able to predict when the person will become violent, and communication is sure key. We want to try and de-escalate patients well before they get to that violent state. So what is behavior? Behavior is what you can see of a person's response to the environment, also his or her actions. Most of the time, people respond very reasonable, very rationally, because over the years, we learn how to adapt to our environment. We learn how to handle stress, at least to a certain extent. Sometimes people aren't so great at managing stress, and so people use negative coping mechanisms such as drugs or alcohol. Everybody has a vice, irregardless of who you are and what your circumstances are. Everybody has something that they turn to when they can't handle stress. Some may be more acceptable, like going to the gym or writing, to where it's excessive. Others turn to substances to do that. Reactions to stress that are acute are generally not going to lead to a crisis. Some of those that develop over time may be the ones that relate to a crisis. A change in behavior that is considered appropriate or not normal typically is what leads someone calling 911, and it's typically not the person that's experiencing that. A behavioral crisis or psychiatric emergency includes patients of all ages that exhibit violent, agitated, uncooperative behavior that are a danger to themselves or to others. Oftentimes, we're called by family or the community. Every once in a while, the patient, yeah, because something has happened that has cause for concern. A patient might have dementia or depression, and their behavior may just interfere with their activities of daily living. Or it could be a chronic depression that suddenly is unmanageable. If an abnormal or disturbing pattern of behavior lasts for a month or more, then it's more of a concern for being a true mental illness. And even with that, it doesn't necessarily mean that it is. Typically, a psychiatric emergency is when the patient shows agitation or violence and becomes a threat to themselves or others. Somebody that has claims of being suicidal, things like that. So mental health illnesses or disorders are very common throughout the United States. They affect tens of millions of people each year. A psychiatric disorder is an illness with a psychological or behavioral symptom, and it may impair functioning. Anxiety disorders are pretty much the most common disorders. There's a couple of different types. There's generalized anxiety disorder, panic disorder, social and other phobias, post-traumatic stress disorder or PTSD, and then obsessive compulsive disorder, OCD. There are several different options for treating mental health illness. Most psychological disorders require professional counseling, often handled by outpatient visits. Some people do require hospitalization in psychiatric units, but that's not the norm. A lot of these issues are handled by a psychologist. Some require the referral to a psychiatrist so that they can manage medications, but a lot of times there's several different factors that come together to make up the treatment plan for somebody that has a true mental illness. Psychiatric disorders can have several different underlying causes. It can be social or situational stress that occurs and is not super long term. You could have legitimate diseases such as schizophrenia. There can be physical illnesses. People that have diabetic issues, especially when they go low, tend to have an altered mental status and become a little more violent. You can have chemical problems, alcohol, drug use, and then electrolyte imbalances can also cause something that resembles a mental health disorder. Sometimes conditions are compounded by non-compliance with prescribed medicines. So they're supposed to be on medication to help control their illness, and mental health or otherwise, and they choose not to take them. Pathophys. So we are not responsible for diagnosing, not at all. This is something that a physician will diagnose, either psychiatrist, psychologist, etc. But we can understand the basic categories of the diagnosis that a physician will use. So there's organic or physical, and then there's functional or psychological. Organic brain syndrome, it can be either temporary or permanent, but it's some sort of dysfunction of the brain caused by either physical or psychologic functioning of that brain tissue. Causes can be something from sudden illness to traumatic brain injury, or it can be other diseases that are progressive, such as Alzheimer's, can be meningitis for an acute infection, and then use of substances. Altered mental statuses can arise from hypoglycemia, hypoxia, if you have some sort of impaired blood flow to your head, hyperthermia or hypothermia, temperature extremes with the body can definitely cause altered mental statuses. In the absence of a physiologic cause, altered mental status then may be an indicator of some sort of psychiatric disorder. Functional disorders, this impairs bodily function when the body seems to be structurally normal. So this could be schizophrenia, anxiety conditions, and depression. This is the chemical or physical basis of the disorders does not alter the appearance of the patient. So you can't really see that hormones or neurotransmitters are imbalanced, but that's often leading to what's going on with the patient. So how are we safe in this? All EMTs should have an approach that they use in a behavioral crisis, ways that you communicate with your patient so that you can be safe but still get the information that you need. There's a table in your book, table 21 or 22-1, excuse me, that helps assure your safety and kind of gives you some more things to think about. So assessing the scene, and then knowing where your exits are so that if you need to get out of there quickly because the scene becomes unsafe, you know which way you're going. Make sure that you have a means of communication with your dispatcher or other EMS services. Don't leave your radio in the car or in the van, or the thing we drive is called an ambulance. So don't leave your radio. Make sure that you have that on you. Have a definite plan of action for if things start going south, and make sure that you and your partner are on the same page with that. Try and de-escalate the patient first and foremost. And you're not going to say, yes, I know how you feel. That's not helpful. If you make use statements, so I understand that you're feeling upset. I'm sorry that you're frustrated. And kind of help exude to the patient that you are there to help and that you want to understand what they're feeling. Calmly identify yourself, be direct, definitely be prepared to spend additional time with the patient talking rather than doing a lot of the skills or assessments that you've been trained to do. Stay with the patient. Don't get too close to a potentially volatile patient. And when you're approaching them or getting down to their level, we should always get down to somebody's level to talk to them. You can see the positioning of the person in the picture. He is not seated. He's in a position that if that patient were to lunge at him suddenly, his first movement would be to stand up and back, which will get him out of harm's way. If you actually kneel down, you're not going to be able to get up very, very quickly. Don't fight with the patient. Don't argue with the patient. If they say that there are purple hippos running around, just say, I understand that you see them, but I don't. You don't have to acknowledge what they're saying is true or say, yep, I see them. You can just acknowledge that you understand that they're seeing them, but that you don't. And you don't have to necessarily orient them to reality either. Express interest in their story. A lot of times what somebody that's experiencing a behavioral or psychiatric crisis wants is just somebody to listen because they feel like nobody understands how they feel or what's going on. Be honest and reassuring, and don't judge. There are several reasons that your patient is experiencing what they're experiencing. So be professional with them and try to talk to them like you would anybody else. We'll stop here and go on in the next one.